Dr. Lawrence Hatchett, thanks for joining us on the Illinois Channel, and you are coming to us from Marion. We see you are, I guess you in your medical offices there?
Yes, we're still up and working, and we're here in Southern Illinois.
For those who are unfamiliar with you, can you give us just a brief rundown of some of your background, where you grew up, and what your practice is?
You know, I grew up in Southern Illinois, a very small town called Culp, and it was a black coal mining town of 250 people. And from there, went on to a very, I'd say, very amazing career, almost like living the American dream. Went to University of Chicago for medical school and finished my training at Harvard University and practiced in Florida for 10 years and decided to come back home.
Well, knowing just a little bit as I do, I've gone down to Southern Illinois, and I know one of the problems has been somewhat of a lack of healthcare facilities in that part of the state. I know down in Cairo, there was, I don't know that there's any hospital in Cairo. There's a medical office there. So we appreciate you coming back to practice in that part of the country and bring the expertise that you bring. Today we want to tell the audience we wanted to follow up with you kind of on two levels. One, certainly your medical background, and maybe we'll touch on the COVID-19, but the other area we wanted to talk to you about, as it kind of says above our head, is the recreational and medical use of marijuana. For those who didn't follow this, we had medical marijuana use first in Illinois because it was found to have medicinal purposes. And then last spring, they passed a recreational use of marijuana, making that legal. This whole COVID-19 coronavirus tamp down has somewhat thrown a monkey wrench into the release of the making the legalization. It did come out in January legal as of January 1st in Illinois and had quite a big opening month. I think there was something like $32 million in sales. Anyway, that's kind of the background for the viewers. Doctor, if you would, tell us just your own background. How did you come to be interested in this whole topic of marijuana? And let's talk about it both from the standpoint of your expertise as a doctor and what you see as its ability to generate jobs and enterprise in the southern part of the state.
I came into the cannabis industry from which is my 91 or 92-year-old mother at the time, who suffered from chronic pain in her legs, and she had gone to all the top universities, and she approached me as a urologist saying, you're my son, you're very bright, you've been to the best schools, do you have anything to offer? Is there anything you can do? So my 93-year-old, she's 93 now, I don't know if she'll be happy I'm telling her age, but I think I'm so proud that she was willing to try something different. I said, I think this is your hope, this is your option. But the problem, I told my mom, I said, trying to start off marijuana the first time in your life at 93, it's going to be a dosing issue. And because we stopped we lost our experience using cannabis for so many years. So trying to get into it, we're trying to find the right dose for her. So that's how I got into it, of all things, my mother.
How long ago was that? And how did you approach the dosing issue? And I think that's a very appropriate aspect of this, because we hear as we talk about the hydrochloroquine and people are saying, you have to get the dosing right, because even on aspirin, if we take too much, it'll kill us. So dosing is obviously a very critical aspect of that. Just tell us just briefly, how did you do that, and then to what extent did it help your mother on her issues?
Well, as we know that you can't overdose from cannabis, and that's one thing, because it doesn't affect your respiratory, and that's why it's being used as an alternative for some people with chronic pain, opioid addiction. But the problem with trying to figure out the endocannabinoid of an individual, it varies from person to person how they're going to respond. and it's really truly a trial and error type of situation. Even in the medical field, medical cannabis versus recreational, it's really not a lot different. Yeah, the medical cannabis locations maybe have some better understanding of dosing, absolutely. But I also think that that's why my group called Cannabliss, that's what makes us unique, is we're made up of physicians as well as pharmacists, and we're trying to figure this out ourselves.
So by saying that, you went into the enterprise of marketing or selling marijuana. Do you have one of the outlets for selling marijuana?
No, we are the Cannabliss group, which I'm the majority, 51% of this owner of this group, and I'm very proud of the team we put together. And we are applying as a social equity applicant right now. And as you know, social equity applicant does not mean I'm African American. It means that we're in a area that has been highly impacted by drugs or poverty, high unemployment. So that's how we're coming into this process. We put in 10 applications for this May 1st deadline. Hopefully we'll hear that we pray and hope that we're going to be selected.
And what do you hope? You know, obviously this is controversial. We had marijuana being illegal and still is at the federal level. Uh, it's been illegal for decades. What advantages do you see for all those who are listening and saying, you know, this is not a good thing? We don't want to have a bunch of people drive around doped up. They might say it's bad enough that often we compare the use of marijuana to alcohol and say how it's better than alcohol and how many people become alcoholics. But perhaps on the other hand, those who would say they're against the use of marijuana would say, why don't we compare it to people not being drugged at all? And why are we pushing this? What advantages do you see to society by having this as a legal product and one that could be used also for medical purposes?
It's because looking back in medicine, it used to be one of the things we used. It was something that numerous articles in the 1800s were written about the use of cannabis for anxiety, for pain, and up into the 1930s, as you know, and it was really more of a political issue when they came up with this Marijuana Taxation Act, and then the war on drugs, and then somehow just through different industries trying to tamp down the use of cannabis or hemp, it really just was put on the shelf for years. So we lost ground in terms of how to best dose, how to use it. So I say that for those people that it has been part of medicine. It goes back centuries. And I think what we need to do is, as you know, it's taken a major leap recently because universities now are starting to do trials and tests, just what we've been wanting to do. So for the people who are saying those things, I would say we need to learn more, absolutely. But it should be utilized, hopefully, as an alternative for many people, my mother and other people included out there who suffer from PTSD, from chronic pain, anxiety, from our veterans who have a dream recall. And it suppresses those things. So we need more tests, but I am happy that my group and the fact that we have physicians and pharmacists involved, that's why what makes us unique. So the Cannabis or Cannabliss group that I head up, we want to be involved with our university down here, Southern Illinois University, which is a great university in the agriculture industry nationwide. We hope to strengthen that college and support them as much as possible and to help answer these questions.
When you are doing this, are you going to be, I mean, as a medical doctor, that certainly makes you different as an applicant. I think most people are probably just entrepreneurs. Are you going to be doing research? I mean, it might be beneficial to all of us to have doctors doing this. Are you going to connect with any of the patients and follow up and say, if it was being used, not merely for recreational purposes, but if it was being used to treat a condition, To what extent are you going to measure that and then maybe be gaining some valuable information for the medical community at large?
We put in 10 applications, and some of those locations are going to be close to universities. We're in talks with universities already about trying to do ships or externships where we have people in the agriculture department who can get firsthand understanding of how to grow cannabis, how to best cultivate and understand the different strains and strands. So we hope to add something so that our Cannabis team wants to be able to get more involved in this, and we do, but we're not going to be involved in medical use. We are applying as a adult recreational use, but we hope that the universities and colleges that we're working with are going to answer some of those questions.
Illinois set up a pretty unique program in that they tried to make sure that some of the economically depressed areas of the state, Southern Illinois is one, South Side Chicago is one, certainly East St. Louis, other parts, they tried to make sure that those communities would participate in the economic advantages of opening up what is a new industry. Share your thoughts, if you would, as one who is applying this and I think has thought through, what do you see as the economic advantages of having these dispensaries and especially in an area like Southern Illinois where you are, where it is typically one of the parts of the state that has some of the highest unemployment?
Well, I think economically, there are a few things there. First of all, as you know, my hat's off to Governor Pritzker and to the legislators for being the benchmark, the role model for all other states in terms of investing back into these impacted communities that you just mentioned. So 25% of the taxation dollars will go back into those communities, and that is something that makes Illinois so unique. And I'm proud of that. Now, as for us right here, in terms of we are a social equity applicant, we hope that each location we will be able to at least offer 10 jobs or more. These are going to be good paying jobs. They're going to have medical healthcare benefits, and that's just for the dispensary. So like I said, we're applying for 10 locations. But that's even still, it goes into even other industries. We'll have to hire, people to drive, to transport. We have to have people who do security. So these are numerous jobs that can be created, and we need these in Southern Illinois.
If you are approved, and hopefully you will know one way or another in the near future, as I say, everyone I think understands the state has been sidetracked, as the whole country has been, by this coronavirus. If you are approved, at what point, how long would it take you to have an open dispensary and to begin hiring and open operations?
It's very open up right away. And like I said, that's one of those situations where time is money. And so we hope within months, we're talking about 3 months at most, we would be from when we are given a license that we can be up and running and have jobs created right away. So we already have locations picked out, at least certainly in the southern part of the state, and maybe take a little bit longer depending how far away we are away from our location here in Marion.
Before if we can, I want to move away a little bit and just talk a little bit about healthcare in Southern Illinois. But before we close the door on this, is there anything else you want to add to this topic on the cannabis?
I want to emphasize the fact that what makes the Cannabis team so different is that we are competing against, as you know, very high dollar groups that are out of the state. And we're all in-state people. Many of us all grew up here in Illinois. So we have every intention of keeping jobs in Illinois, hiring people in Illinois, and we don't have a bunch of looking just at the financial impact of getting a license. We're looking at what it means to our community where we live, and I think that's what makes us unique.
Yeah, I've gone down to Southern Illinois a number of times and done stories, and I will share it's certainly one of the prettiest parts of the state. It is not flat. I grew up in St. Louis, and when you go to St. Louis and you're typically driving from St. Louis to Chicago, you get the idea that Illinois is as flat as a pancake.
Yeah.
It is not when you go to Southern Illinois. It is part of the Ozark Mountain Range. You have rolling hills, a lot of forests. It's beautiful. Obviously, Garden of the Gods, not far from where you are. But we said it is an impoverished area. I had someone tell me about 20 years ago, he was a committeeman in one of the counties and said, Terry, the best job you can get down here is to be a prison guard because you get state pay and state benefits, and if you don't have that, you're working at the 7-Eleven. So it kind of, not literally true, but it does emphasize the idea of poverty in that part of the state that is so beautiful. As you hire people, the other thing, and it's interesting you say too, you're going to be giving them benefits for your employees in the cannabis industry. Let's talk about healthcare. What is the condition of healthcare? You said you came back from Florida to practice here, which is commendable. What did you find, and how, having worked elsewhere in another state, what strikes you as far as the dichotomy between areas that are more heavily populated, like a Chicago, like a Florida, and the conditions we find in Southern Illinois?
I think I find the lack of healthcare has added to some extent the comorbidities. And so we see many different comorbidities here in Southern Illinois that we don't see in other parts of the state, majority being diabetes and obesity. And that's even looking at why maybe even the COVID virus has also even affected the African American community more, because we see more of that as well as in closer tight areas. So the comorbidities have really played a role in the virus, but also with healthcare.
The governor the other day spoke about this. We've been carrying his press conferences daily, and they were talking about there being a higher incidence within the African American community. What accounts for that, would you say? Is it cultural? Is it, sometimes we talk about food deserts? And in that area, I know in the south side of Chicago, there were certainly food deserts. And, you have to force yourself, for those of us who don't live. I live in the Springfield area. There are a multitude of grocery stores to go to. But we have people living in some parts of the state where there are no grocery stores, and they are literally going to the gas station to buy groceries just to buy food. And I think then obviously that leads to sometimes they're eating Doritos and Cheetos and that kind of thing. Am I on the right track, or what actually accounts for what we're talking about here with a higher incidence of the not just the COVID-19, but just high blood pressure and diabetes within, say, the Black community?
I think you hit on it. It's both cultural and it has to do with geographic area. I think even Magic Johnson just said the other day that there's almost a cultural belief in the African American community back when they didn't think HIV was as common as African. I think same with the COVID, but also seeing that there is a greater situation with obesity and with heart and lung disease. And then, of course, we have the whole issue of just trying to get fresh food and how to get there. And a lot of it's by mass transit. I have a sister who never had a driver's license in her life. She lived in Chicago and took the bus everywhere. So it's all those factors rolled into one, which makes it a difficult process and hard to figure out one simple answer.
I find it, one of the things that's interesting is, to me, the dynamic nature of the American society, how quickly we change and adjust. And we look back and then realize that. I remember as a child growing up, and we had a can of lard next to the stove, and we would just dollop lard. There used to even be advertisements, to buy a can of lard. and how we would deep fry things. And of course, we've gotten so far away from that primarily. And I think we in general eat better and are better aware of how diet also impacts health. And I often have said in the past, if we take an aspirin, we think it's going to do something for us. If we take a pharmaceutical pill, we think it's going to do something for us. But if we eat half a gallon of ice cream, we think it's not going to do anything. And I think, diet obviously has a big impact on our whole healthcare system and the ability of doctors like yourself to make sure that their patients remain healthy.
Yeah, I do. I make a joke sometimes. I say there seems to be a cure for obesity that starts right around Colorado going west. And I mean, so something they must have an answer. And 80-year-old people just say, "Excuse me, can I get past you?" And because it's so different in terms of lifestyle in that part of the country, and we don't. Even my colleagues, they practice medicine different out there because of longevity than how I practice in this area, which is we don't see our patients living as long.
We hope that maybe we can follow up with you. There's so many different topics. I'm going to try not to cram them all into one interview. But let me just say, I started to say if you had the governor's ear, maybe you do have the governor's ear, I don't know. Relative to healthcare in Southern Illinois, and I know from doing some previous stories, as I think I mentioned earlier, that there's just sometimes a lack of care in some of those areas. In fact, I often say too, and one of the things the Illinois Channel is trying to do is give a greater appreciation for the regional differences around the state. About 20 years ago, I was doing a story on how a small community was trying to get a waiver from the Illinois Department of Public Health because they were supposed to have 2 EMTs in the back of an ambulance, and they could barely find one. And if you're from Chicago and you don't need that waiver, you might go, well, that's too bad for Southern Illinois. I would remind the people from Chicago, if your son or daughter was driving down to go to school at SIU and were in a head-on accident, they might be wanting to know that there's an ambulance that's going to show up if someone calls 911. What would you say to those in the legislature as well as the governor about what are the needs of Southern Illinois relative to healthcare in general that could be met? Everyone always wants a bunch more money, but if money is the answer, but are there other things that we could do that maybe, given the state's finances, that would make improvements that wouldn't necessarily require billions of dollars more?
I don't know if I can give advice in terms of what to do, but I will tell you that what makes a difference to come to Southern Illinois is if you are from Southern Illinois. And I would have never thought of coming. My friends say, "You were trained at University of Chicago, and what are you doing practicing a small town?" I say, "Because I want to as well." So we do have many people who grow up here, and it makes all the difference in the world. The hard thing in small rural areas is recruiting. So it's really that I don't know if the governor or other people or hospitals can do any more than they're doing now. It's trying to convince someone to live in a smaller rural area. Amazing. Like I said, beauty is amazing. We are economically depressed. That's why we hope that this industry is going to bring back jobs.
Go ahead. I'm sorry.
I don't know if I froze there or not, but I'm happy to be back. And I grew up and like I said, I went against all odds growing up in a small, wholly impoverished town, 250 people. And it was from my experience walking from kindergarten through 4th grade, walking through the campus of Southern Illinois, where I went to university school called U School. I had that opportunity, and that changed my life as a kid who grew up within a segregated part of this country at that time. It made all the difference. And that's why I'm so grateful to SIU. That's why I want to help them so much with this cannabis industry and to partner with them, because they meant to me as a child and still to this day.
I know there are other things going on in Southern Illinois. We also have the expansion of gaming. We have Walker's Bluff down there, one of a nice winery, yes. And they were the recipients of one of the gaming. So there are things going on in Southern Illinois that might really make a difference in the economy. And of course, there's the natural advantages of fishing and hunting and hiking, and you don't have to sit too long in rush hour traffic as you do if you're in the Chicagoland area. So there are some wonderful natural advantages to being in that part of the state that we shouldn't fail to mention. But
Yeah, we really want to make this a destination point. With the gaming, like you said, at Walker's Bluff, it would be a tremendous benefit for the cannabis team for us to also add to that and to give people another reason why you'd want to come here. And we hope to not just partner with the university, maybe even have music venues, and to just open up more to people and older people and try to offer them options. And I think the fact that we have doctors and pharmacists involved, it may surprise people that they may take a walk through that door and say, I heard about your group and your unique difference. And a lot of doctors are a little nervous about stepping out into this industry, and I think we have to step out. We have to play a role because it's part of what is part of our history.
well, for better or for worse, I say that to be neutral. It's probably, I would say, at that point in our nation's history where we are going to be moving toward, as Illinois has, legalizing marijuana. There's still a lot to be worked out. I mean, it's a problem if you're a truck driver. You can't be licensed as a truck driver if you're using marijuana, even if it's okay in Illinois. It's not okay as far as the federal officials are concerned. So there's a number of other legal issues that to be concerned. But before we close out, let's go back. We didn't hear, what impact did the use of marijuana have on your mother? Did it help her?
Yes and no. She's still, I just talked to her just last week, in fact, and she is going to try another medical location with a different physician because the first attempts is, once again, the cannabis does not affect our respiratory system, so we can't overdose. But still, you can feel a little lightheaded, and she's still so sensitive with the dosing. She's still looking for the proper dose. She said it worked for a while, but then she had a side effect, and it scared her a little bit. So we're still. I told her, I said, Mom, you got to keep trying. And it's unfortunately it's one of those situations where there's just no take this milligram of dose or take this specific one. It's not that it's simple. So I'm wishing the best for her because she's suffered from this so much.
One of the things I found very compelling, I'll share, is when we were in the state capitol and we were arguing whether we should have the use of medical marijuana at that time. And we had a fellow, a Vietnam vet who was sprayed by Agent Orange, and other people with other conditions. It is very compelling when you hear someone who has been physically suffering and they testify that the use of marijuana actually helped them. In fact, I interviewed one young lady who has remained a Facebook connection, who says her prognosis is anywhere from 1 day to 5 years. But when she was taking the typical medicines, she said it was as if she was recovering from a bad hangover. She couldn't get off the couch. That's from some of the opioids. She didn't have any quality of life. And when she started using marijuana oil, she actually now could have a normal life and go to her son's baseball games. And it did make all the difference in the world and kind of opened my eyes, because I wasn't that person suffering, but you see the suffering of others and how it was alleviated. Let me ask you, when we talk about marijuana, we talk about it as if it's universal. I don't know if it is or not. We have all kinds of coffee. They taste different. Is when we talk about marijuana, are there different kinds of marijuana, and does that make a difference in the use of marijuana as a pharmaceutical?
It's going to be, and as you know, and I know your topic up there says recreational and medical marijuana, but it's almost like we prefer to use the word cannabis because it's almost like marijuana has a connotation that people sometimes misunderstand. And with the THC part, as you know, the THC is the one that is the can be a psychotropic, and the strands are different, but the percentage of the THC is different.
Dr. Hatchett, let me go back to your application for the license for the dispensary. There was, as people like Toy Hutchison, who's a state senator at the time, she's now the head of the program, and she wrote in there the social justice component to make sure that minority communities are represented. In your application, what are some of the minority representatives, if you have any, aside from yourself, and to what extent does that make a difference, do you think, in this program?
Well, as you know, there can't be any type of quota system because that has been fought legally in other states. And I think as the governor and everyone working on this says, this is not a perfect process, but they said it's going to be a fair process, adding this social applicant portion, which gives you extra points in your application process. Hopefully, during that process, there is going to be more minority involvement. And my particular cannabis team, I am the 51% owner, but we have 2 Hispanic females, very talented women. We have Army veteran who's a doctor, GYN. But we make up a mixture of, I think, what represents Illinois and what represents this country. So our team and our group is almost a great representation of this country, and that's what we hope is going to make us a great group to represent this industry.
Have you put together, I guess you put together, like anyone else, a business plan? You probably project how much sales you're going to have. These are always guesstimates when you start off, but based on some research, and how much money you might see coming in, how many people you would project hiring. How viable of a business would this be, do you imagine?
Well, we kind of really went at it as a standpoint, surprisingly, of how much it would be economically to a town such as Marion or Carbondale. Let's take Carbondale, for example. That could bring in $750,000 of tax revenue to a city like that, and that's huge. And surprisingly, we have not been focusing on how much we're going to make, and that's what's surprising. I don't even remember many times that our group sat and say, how much are we going to make? And we've talked about how we're going to do philanthropic things. I know it sounds too good to be true, but I think we put together a team of people that really came together for the right reasons and not just for financial reasons. It's really to advance this industry and to have more minority representation. And that's part of the reason why I even personally decided to go to Southern Illinois University, and I personally set up a scholarship for African Americans to go into the Department of Agriculture with a specific emphasis on cannabis. As I said, this door is going to open and close so quick. If we don't find the right African American and Hispanic kids to get in this industry very quickly, the door will be shut before they know it. And so I've already put up a $100,000 scholarship, $25,000 per year for the next 4 years out of just personally. That's what I just did myself because I want to see reputation, and that's my way of giving back. I've always been very philanthropic, and that's what Cannabis is all about.
Doctor, we've kept you longer than I anticipated, and I'll ask the indulgence of our viewers. Sometimes when we are doing these over the internet interviews, they generally work pretty well, and certainly beats driving all across the country. But sometimes we get a little bit of a connection that freezes up, and it's not perfect. But I always like that saying, don't let the perfect be the enemy of the good. And this is wonderful that we could join with you today. We thank you for your time on the Illinois Channel. Hopefully we can visit again.
It's been a pleasure, and I just appreciate the opportunity very much so. So thank you.
Thank you again, sir. Thanks for watching, and if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching. I'll put this together and we'll have it on the air this afternoon.